Hello and welcome to today's presentation. This YouTube channel is about how we can learn, we can be motivated, and especially in matters healthcare. And today I'm going to talk about how to succeed as a nurse. I, being a nurse by profession, I'm going to address this to my colleagues and even those aspiring to do nursing. And welcome. So I'm going to look at 10 ways, and we know that nursing requires a combination of clinical skills, so you need the knowledge. It also needs the compassion. Do you have the heart to be a nurse? And strong communication abilities. Again, those are three key things that requires. And one way to succeed is develop strong communication skills. You want to be clear, go straight to the point. You are able to make a phone call maybe to the other colleagues in the department, or to the patient. You're empathic, you're able clear, your people understand what you're saying, and this will enable you to build trust and ensure delivery of quality care to the patient. So we must have strong communication skills, both listening and speech. Secondly, you're continuously learning and staying updated. Again, nursing is constantly evolving and technology is changing. For example, even the other day I had a surgeon talking about robotic surgery, and even the team in theater need to learn how to be assist in such cases. So stay updated, learn best practices, and always update yourself on latest advances. Attend workshops, attend conferences, continuous education, seek opportunities for professional development, and they're there. This will help you to build skills and knowledge. The third one is prioritize self-care. Again, nursing can be physically and emotionally draining. You want to maintain a healthy work-life balance so that you engage in activities that are rejuvenating, where you find rest, the mind is relaxed, and you take care of yourself. Again, also it's the time to think about your side hustles, how to maybe other sources of incomes, and during your offs, and how to support yourself, because these are things there is usually life outside nursing. And plan your finances, also balance time with family and all that, so you're able to look at the other things away from work. So prioritize self-care, and also just find that rest so that you're rested enough, ready to go back to work the next shift. Fourth one is cultivate empathy and compassion. Nursing is a caring profession, so you have to be empathic, put yourself in the patient's shoes. You have to have a lot of compassion. We mentioned these are vital qualities. Put yourself in the shoes of that patient, understand their needs, be kind, be respectful, be understanding, and all this give a patient a positive patient experience. We want to give wow experience, so that experience that the patient will just remember the care they received. They will not remember the illness that brought them. They will not remember the pain or the anything else, the experiences that they had, but they will remember that care that they received, and they'll be smiling even when they're paying that bill. They will not argue about it. They'll give the best report or reviews, and they'll always come back. The fifth one is build a strong support network. Again, we said nursing is challenging. You need a strong support network, can be colleagues, mentors, fellow nurses, even family members. Again, you need to seek out guidance. You need to share experiences and offer support, especially during tough times or difficult shifts. Sometimes you have lost a patient and it just takes you down, and you want just that support that it will be okay. You did your best. Yeah. Sixth one, be organized and manage your time well. Now we need to be organized. Do you report on duty on time? Do you prioritize your tasks? Do you do a risk assessment to see what you need to, the tools, the environment, what you need to change, what you need to prepare yourself for the situation ahead or the duties allocated to you? How to manage multiple responsibilities and ensure timely and accurate documentation. Remember, in documentation, we say that what is not documented is not done. So you want to ensure that you're documenting and on timely documentation, so that everyone can see the work that you have done and recorded. The seventh one is seek opportunities for professional growth. We have said that our career is growing. There's diverse career paths, specializations. Be proactive, attend your conferences, go for higher education, get involved in these organizations, take the initiatives, and the doors will open for you. So you want to keep on knowledge learning. The eighth one is embrace teamwork and collaboration. Again, nursing is a team-based profession. You cannot handle the patient by yourself. There are other disciplines that are involved. There's a physiotherapist, the doctor, the nutritionist, and all that. There's a biomedical team. There's a housekeeper, your nurse assistants. They are there. Collaborate with other healthcare professionals. Respect the expertise and perspective of your colleagues, and actively contribute to a positive and supportive work environment. The ninth one is stay calm under pressure. We encounter stressful situations, especially in emergencies or working in critical care areas. You need to be calm, especially in emergencies during situations. That team leader needs to be organized, needs to allocate roles so that we don't have that confusion or temperatures, flaring and all that stressful situation. So as a nurse, you need to practice being calm and composed even during high pressure scenarios. Be a problem solver and a critical thinker. Again, those are calm. Remember, the patient also is speaking from you. Like I was sharing with somebody who works in the critical care, and I was saying that how they were sharing to the patient that this patient was due to be done for a tracheostomy because they had stayed for long with the tube and endotracheal tube, and they needed to be put a tracheostomy now. But she was able to encourage the patient, and she willed it that this patient will be able to breathe on their own. And within 2 days, this was reversed, and the patient was able to breathe on their own. So walk the journey with the patient, put yourself in their shoes. She knew that now that will be another added problem to the patient, and we are after the recovery or wellness of this patient. So again, those are stay calm, be a critical thinker, be a problem solver, and do your best. The 10th one and last one is maintain a positive attitude. You will go a long way. I can tell you for sure that the ones who have maintained negative attitude have not lasted in this profession. And you want to go a long way. You approach challenges with optimism. Strive to create a positive atmosphere for your patients and colleagues. Inspire others around, and we all want to have that person in the shift who inspires us. That all will be well. We'll finish the shift well. We'll go and hand over. All that. So you want to maintain that positive attitude, and it's infectious. Share it around. It will inspire others too. Finally, nursing is a rewarding profession and requires continuous dedication and growth. Please enhance your skills and provide excellent patient care. Succeed as a nurse. Go on, mentor others, do your best, yes, and give that the best experience to the patients that come your way. All the best. Thank you.